If generally speaking, if somebody has a blocked artery, if somebody is having a heart attack, we will bring them to the cardiac catheterization lab in an emergent sort of fashion. And they're put in a special table with an X-ray camera that rotates around them. They're all covered and draped. And then we enter their artery. This can be entered in two locations. We can do it at the radial artery, which is in the wrist over here, or we can do it in the femoral artery, which is in the groin area. Once we've entered that artery, we put a catheter in there or a sheath, which is like a large IV. So no blood comes out of it, and we can put stuff through it. Once we've got that access, then we take catheters, which are small spaghetti-like tubes, and thread them under X-ray close to your heart and enter the blood vessels of the heart. You know, the heart's like my fist, just sitting right here in the chest. Just like my three fingers, there are three main blood vessels that supply blood to the heart. They're sitting right on top of the heart like that. You know, they're called coronaries because it comes from the Latin word corona, you know, which is like a crown, you know, on top of the heart. So we enter these blood vessels, one at a time, inject contrast through them, and then make X-ray pictures. Then by looking at it, we can tell if there's a blockage or not. In fact, you know, a common person who's not trained can tell if there's a blockage or not. A normal artery is nice and smooth and it tapers as it goes down. A narrowed artery looks like an hourglass, you know, so where the built-up has occurred, it becomes narrow. A totally blocked artery looks like a stump. So the artery comes in and stops right there. You know, it doesn't taper down. So once we have located the blockage, then we take a wire, which is a very thin wire, just a little thicker than a common person's hair, and we thread it across the blocked artery. Once we've got that open, then we open it up with a balloon, and generally we put a stent, which is a metallic spring-like device, inside the artery, which acts like a scaffolding device inside the artery and prevents it from collapsing. So the modern stents are very sophisticated. They're specially coated with a drug that blocks scar tissue formation. So down the road, the results are excellent.